Question here, the nurse is caring for 8 years old following a routine tonsillectomy, right? Removal of tonsil. Which findings should be reported immediately? A, reluctance to swallow, drooling of blood-stained saliva. Number C, axillary temperature is 99 degrees Fahrenheit and respiratory stridor. So the D is correct, right? So if patient have a shortness of breath, stridor, respiratory stridor is a symptoms of partial airway obstruction. So answer is D. Answer A, B, or C are expected with a tonsillectomy. Therefore, they are incorrect. Next questions here. The nurse is admitting a client with a suspected duodenal ulcer. The client will most likely report that his abdominal discomfort decreases when he, number A, avoid eating, number B, rest in a recumbent position, number C, eat a meal or snack, number D, sit upright after eating. So correct answer is number C, right? Eat a meal. Why it is answer? So pain is associated with duodenal ulcer. So pain associated with duodenal ulcer is lessened if the client eat a meal or snack. So patient willingly to eat means they have a less pain. So answer A is incorrect because it makes the pain worse. Answer B is B is lessen the discomfort of dumping syndrome. Therefore, it is incorrect. Answer D, lessen the discomfort of gastroesophageal reflex. Therefore, it is incorrect. Next question goes here. The nurse assessment or assessing a newborn in well baby nursery. Which findings should alert the nurse to the possibilities of cardiac anomalies? Number A, diminished the femoral pulses. Number B, they said sign. Number C, circummoral failure. And number D, acrocyanosis. So correct answer is diminished the femoral pulses. So answer A is correct. So diminished the femoral pulse are a sign of coarctation of aorta. So answer B, C, and D are found in normal newborn and are not associated with cardiac anomalies. The question here, the charge nurse is formulating a discharge teaching plan for a client with mild preeclampsia. The nurse should give priority to A, teaching the client to report a nosebleed. Number B, instructing the client to maintain the strict bed rest. Number C, telling the client to notify the doctor of pedal edema. And number D, advising the client to avoid sodium sauce in the diet. So correct answer is teaching the client to report the nosebleed. Why number A is answer? A nosebleed is in the client with a mild preeclampsia may indicate that the client blood pressure is elevated. Means preeclampsia lead to develop eclampsia with the abnormal movement of muscle, or we call seizure. So when patient have seizure, we said eclampsia. Without seizure, we say preeclampsia. Number B, C, and D is incorrect because the client will not need strict bed rest, or patient do not need pedal edema is common in the client with preeclampsia. The client does not need to avoid sodium, although the client should limit to avoid high sodium food. Next, the nurse is preparing to discharge a client who is taking monoamine oxide inhibitor. The nurse should instruct the client to, number A, wear protective cloth and sunglasses when outside. Number B, avoid over-the-counter cold and hay fever preparation. Number C, drink at least 8 glasses of water a day. Number D, increase his intake of high quality protein. The correct answer is number B, right? So avoid over-the-counter cold and hay fever preparation. Why? The client who taking an monoamine oxide inhibitor, MAOI inhibitor, should avoid over-the-counter medication for cold and hay fever because many contain pseudoepinephrine. Combining with MAO inhibitor with pseudoepinephrine can result in extreme elevations in blood pressure. So answer A is incorrect because it referred to the client taking an antipsychotic medication such as thorazine. So if patient take the antipsychotic medication thorazine, answer A should be correct. Answer C is not specific to the client taking an monoamine oxide inhibitors, and answer D does not apply for this patient. Next, which following meal selection is appropriate for the client with celiac disease? So if your patient have a celiac disease, which food is good for them? Toast and jam and apple juice, peanut butter, cookies and milk. Number C, rice, crispy, bar and milk. Number D, cheese, pizza, and Kool-Aid. The correct answer is peanut butter, cookies, and milk, right? Appropriate. So increase the thirsty, I mean, so no, correct answer is not the B, is not a good choice. So the which of the following meal selection is appropriate for the client with a celiac disease? It should be a rice, crisps, bar, and milk. Number C, because patient has a celiac disease. So the food contain the rice or millet are permitted in the diet of celiac disease. A, B, or D are not permitted because they contain the gluten, right? Or which exacerbate the symptoms of celiac disease. Gluten exacerbates the disease. Therefore, A, B, and D is incorrect. What else? A client with hyperthyroidism is taking lithium carbonate to inhibit the thyroid hormone release, which complaint by the client should alert the nurse to a problem with the client medication. So my patient has a hyperthyroidism and taking lithium carbonate, right? So inhibit the thyroid hormone release, which complaint by the client should alert the nurse to problem with the client medication. Number A, the client complain of blurry of vision. Number B, the client complain of increased thirsty or increase the urination. Number C, the client complain increase the weight gain over the past year. And the client complain of rhinorrhea. So the correct answer is B. So client complain of increase the thirsty or increase the urination. So increased thirstiness or increased urination are the sign of lithium toxicity. So we have to concern. So answer A and D are not associated with the use of lithium. Therefore, they are not answer. And C is an expected side effect of medication, increased weight gain. So therefore, it is incorrect, not an answer. The physician has ordered intravenous fluid with potassium for a client admitted with gastroenteritis and dehydration. Before adding potassium to the intravenous fluid, the nurse should, number A, assessment the urine output. Number B, obtain arterial blood gases. Number C, perform dextrostic. And number D, obtain the stool culture. So correct answer is assessment urine output. Why it is answer? During the dehydration, because our patient with the gastroenteritis and dehydration. So during dehydration, the kidney compensate for electrolyte imbalanced by retaining potassium. The nurse should check for urine output before adding potassium to the IV fluid. So answer B is incorrect because it measured the respiratory compensation because of dehydration. Answer C and D do not apply to the use of intravenous fluid with potassium. Therefore, they are incorrect. Next here, a 2 months old infant has just receiving her first tetraamine injections. The nurse should tell the mother that the immunization about what? Number A, will need to prepare when the child is 4 years age. Number B, is given to determine whether the child is susceptible to the pertussis or whooping cough. Number C, is one of a series of injections that protect against diphtheria, pertussis, tetanus, and Haemophilus influenza B. Number D is a one-time injection that protect against measles, mumps, rubella, and varicella. So the correct answer is C, about these immunizations. So the immunization protection the child against diphtheria, pertussis, tetanus, and Haemophilus influenza. Answer A is incorrect because the second injection is given before 4 years of age. Answer B is not a true statement, and answer D is not a one-time injection. Nor does it protect against measles, mumps, rubella, or varicella. Next here, a client with Addison disease has been received glucocorticoid therapy, which findings indicate a need for dose adjustment. Number A, dryness of the skin and mucous membrane. Number B, dizziness when raising to a standing positions. Number C, a weight gain of 6 pounds in past week. Number D, difficulties in remaining sleep. So correct answer is a weight gain 6 pounds in the past weeks. This is the answer. Why? So a weight gain of 6 pounds in a week in the client taking the glucocorticoid therapy indicate that the doses should be modified. Answer A and B are not specific to this question. Therefore, they are incorrect. Answer D is an expected side effect of medication. Therefore, it is incorrect. What next? The nurse is caring for obstetricals client in early labor. After rupture the membrane, the nurse should give priority to A, applying internal monitor. Number B, assessment the fetal heart rate. Number C, assisting with epidural anesthesia. Number D, inserting a Foley's catheter. So the correct answer, assessment for fetal heart tone. Correct answer is the B. Why? So assessment, the fetal heart rate reveals whether the fetal distress occurred with rupture of the membrane. Answer A, C, and D are later intervention. Therefore, they are not correct or they are incorrect. So which one should be priority here? Next, physician has prescribed levothyroxine. The other name of these drugs, Synthroid. So levothyroxine we give hypothyroidism patient. For a client with myxedema. Myxedema is a complication of hypothyroidism. Which statement indicate that the client understands the nurse teaching regarding levothyroxine? Number A, I will take this medication each morning after breakfast. Number B, I will check my heart rate before taking this medication. Number C, I will report visual disturbance to my doctor. Number D, I will stop this medication if I develop gastric upset. The correct answer is number B. I will check my heart rate before take levothyroxine. So Synthroid or levothyroxine increase the metabolic rate and cardiac output. Adverse reaction include tachycardia and dyspnea. Therefore, the client should be tough to check the heart rate before taking this medication. So answer A is incorrect because the client does not have to take medication after breakfast. Answer C does not relate it to the medication. Therefore, it is incorrect. And the medication should not be stopped because of gastric upset. Therefore, answer D is incorrect. So if your patient needs to take levothyroxine, it is important to educate them to check their heart rate. So I will check my heart rate before taking the medication.